Are you aware of the importance of ketones in diabetes? Why people with diabetes develop ketones? How should they be prevented, and what should be done if they're high? Let's take a simple approach to understand ketones and see what can be done to prevent them from developing. Ketones are basically byproducts produced as a result of burning alternative fuel in the body. You can think of a hybrid car which runs on two different forms of energy. One is the clean energy, which is electricity, and the other is the dirty fuel. It comes in form of petrol or diesel. When the car runs out of electricity, it runs on the alternative fuel, which could be petrol or diesel, and that produces the byproduct, which is smoke. Now, in a human body, we have got the ready-made energy in form of carbohydrates, which it utilizes from the food. And in order to use carbohydrates, we need insulin. There is a very precise balance in the insulin and the counter-regulatory hormones to maintain glucose levels where they should be. If this balance is disturbed for any reason, like for example diabetes, then the counter-regulatory hormones override the effect of insulin. Insulin is a mandatory hormone to be present in our blood to help the body utilize carbohydrate as a form of fuel. Without the insulin, the body starts looking for alternative forms of energy under the influence of counter-regulatory hormones. This brings back the hybrid car model, in which two different fuels can be utilized for energy production. One is the rapidly available and readily available energy in form of carbohydrates. The only way to utilize that is availability of insulin, which is the battery charge. And the other fuel is to burn the fatty acid. Once the body runs out of insulin, it cannot utilize carbohydrates as a fuel. And in order to run effectively, the body starts looking for alternative forms of fuel, which is to burn the fats. And that produces the byproduct in form of smoke, which is ketones. The most important thing to know is, when does the body produce ketones? And this is when there is a state of complete insulin deficiency. There are certain common triggers for ketone production. Complete lack of insulin is one of them, and anything that raises the counter-regulatory hormones like sepsis, dehydration, starvation, being nil by mouth, or drinking plenty of alcohol. The other important question to know is, when should a patient with diabetes have a ketone test done? You must test for capillary blood ketones in any patient with diabetes with metabolic acidosis. Anyone who has type 1 diabetes and blood glucose more than 14 on 2 occasions should have a ketone test done. Anyone who is unwell with type 2 diabetes and is taking one of the newer medications in the group of SGLT2 inhibitors, which end up in the name of gliflozins, should have a ketone test. Anyone who has a suspected diagnosis of new type 1 diabetes must have a ketone test. Ketones can be tested through point-of-care ketone testing machine. What level of ketone is considered to be significant? A capillary blood ketone of 3 millimoles or above is considered to be significant risk for impending diabetic ketoacidosis. It requires an urgent doctor's opinion and an urgent blood gas to rule out metabolic acidosis. What can you do when you find high ketones? It is simple. You need to rehydrate, give insulin, and give carbohydrates. We know this is an insulin deplete state, so all people who have high ketones and have diabetes need insulin. Not all levels of ketones are worrying, so you need to know which levels are significant. A capillary blood ketone below 0.6 millimoles per liter is considered as normal. All you need to do is to treat hyperglycemia and ensure the regular diabetes medications are taken. A capillary blood ketone level between 0.6 and 2.9 millimoles per liter suggests significant impending risk of decay. You need to inform the doctors, treat hyperglycemia, and retest ketones in an hour's time. Make sure the patient is hydrated, has received their insulin, and are taking carbohydrates. And the triggers for ketosis have been dealt with. A capillary blood ketone level of 3 millimoles and above is most likely as a result of diabetic ketoacidosis, and it needs to be ruled out immediately by doing a venous blood cast to exclude metabolic acidosis, and the doctors have to be informed. The patients are likely to be unwell and need IV insulin and fluid in majority of circumstances to normalize the biochemistry. Ensure the triggers for ketosis have been dealt with. Please ensure that your diabetes team is aware of any patients who develop diabetic ketoacidosis. And if you're not certain about managing ketones, feel free to contact your diabetes team, as we are always there to help you.